Welcome to this deep dive. As a medical microbiologist, you're probably pretty familiar with this topic.
Yeah.
Acute infectious diarrhea,
Right.
gastroenteritis.
Mm.
But stick with us, because we're going to use the World Health Organization's
Okay.
AWARE book,
Cool.
Access, Watch, Reserve,
Yeah.
their antibiotic book,
Wow.
as our guide today. And I think you'll find it particularly interesting, even as a seasoned pro, because
Yeah.
there's actually some surprising things in here.
Oh.
Like, did you know that most cases don't actually need antibiotics
Oh, interesting. Okay.
and that malnutrition can make it worse and be a consequence of it?
Huh. Okay.
It's a lot.
Yeah.
So let's break it down.
Sounds good.
How does the WHO define acute diarrhea?
Well, they define it as a disease with a sudden onset of diarrhea,
Okay.
characterized by 3 or more loose or watery stools per day.
Okay.
But interestingly enough, the consistency of the stool matters more than the frequency.
Oh.
So someone can be going to the bathroom quite often, but if it's well-formed,
Right.
it's not technically considered diarrhea.
Okay. That makes sense. I see. Now, the AWARE book also specifically excludes C. diff infection and enteric fever from this definition.
Right. That's covered in other chapters. This is just dealing with the acute infectious diarrhea.
Gotcha. So let's talk about what this looks like in a patient. What are some typical symptoms?
Sure. Well, apart from the diarrhea itself, you might see some nausea, vomiting, bloating, abdominal pain.
Okay.
Fever can be present, but it's not a given.
Okay.
And while most cases actually resolve on their own,
Mm-hmm.
dehydration is a major concern, especially in children of the elderly.
Yep, I would imagine so. I
Yeah.
would imagine so. And that's where I think that malnutrition link comes in.
Right.
Right, because...
Yeah. So malnutrition can increase the chances of getting diarrhea in the first place.
Wow.
And then if they do get it, it can make their nutritional status even worse.
Oh,
It's like a vicious cycle.
so it's like a double whammy. The malnutrition sets you up,
Exactly.
and then the diarrhea makes the
Yes.
malnutrition worse.
It's a really important thing for clinicians to keep in mind.
Yeah, absolutely. Absolutely. So the book actually goes through these 5 common presentations that kind of guide your treatment.
Right?
And they talk about watery diarrhea, bloody diarrhea, persistent diarrhea,
Mm-hmm.
diarrhea with severe malnutrition, and diarrhea with recent antibiotic use.
Right.
So those are our 5.
Yeah.
Okay. So lab tests. I had a little bit of an aha moment when I was reading this
Yeah.
because they emphasize that routine stool testing isn't usually needed.
I know, right?
I know,
Yeah.
it seems so counterintuitive,
It does.
but it makes a lot of sense.
It does.
Because most cases are viral. They're
Mhm.
going to run their course.
Yeah.
You really need to focus on symptom management
Right.
and preventing dehydration.
Yeah. Exactly.
And that's it.
Yeah.
So when is testing important?
Okay, so testing is important if there's blood in the diarrhea because that could be a sign of a bacterial infection.
Right.
Same goes for immunocompromised patients because they're more vulnerable to complications.
Right.
In a suspected cholera outbreak,
Right.
testing is essential.
And I would also imagine if someone had just recently taken antibiotics to rule out C. diff.
Exactly.
Okay.
And when testing IS deemed necessary, there's a couple of options. You got stool microscopy, culture, antigen testing, and nucleic acid amplification tests.
Yeah. Makes sense.
Yeah.
Makes sense. Now, this next part is really geared towards you, the microbiologist listening. And that's the importance of these targeted clinical microbiological surveys.
Right. These are so important because these surveys really help inform our local antibiotic guidelines,
Okay.
especially when we're monitoring resistance rates in Shigella non-typhoidal salmonella.
Okay. So it's about staying one step ahead.
Exactly. By focusing on quinolone and macrolide resistance, we can really ensure that empiric treatment is appropriate.
Okay. That makes sense. So what about other lab tests?
Generally, other extensive blood work is unnecessary. But in severe cases, especially when dehydration is a concern,
Right.
checking electrolytes is super important.
Okay. Good to know. And imaging.
Not really needed for this condition.
So we can save those x-rays for something else. Okay.
Exactly.
So treatment. And the star of the show, rehydration.
Yes, rehydration is the foundation of treatment for acute diarrhea. Doesn't really matter what the cause is. And it can be done with oral rehydration solutions or IV fluids.
Right. And in children, the WHO recommends low osmolarity
Right.
oral rehydration solution.
Right. And adults can often just increase their fluid intake.
Okay.
But for kids, that specific solution is key. There's also evidence that zinc supplements can help reduce the duration and severity in children as well.
Oh, interesting. Interesting. Okay, so what about anti-diarrheal medications? A lot of people reach for that stuff.
Right, it's not routinely recommended.
Oh,
Because while it can provide temporary relief, it doesn't actually address dehydration or improve nutritional status.
okay. So we need to stay focused on rehydration.
Exactly.
Okay.
Yeah.
So antibiotics. We know that they're not needed in most cases. So when are they considered?
Okay. There are two main scenarios where antibiotics might be considered. So the first is significant acute bloody diarrhea,
Okay.
because that suggests a bacterial infection that might benefit.
Okay.
The second is for severely immunocompromised patients,
Right.
because their immune system might need a little bit of help.
Okay. Makes sense. Now that there is some controversy, I remember reading about surrounding antibiotic use in E. coli cases, like Shiga toxin-producing E. coli.
Right.
So can you tell us a little bit about that?
Yeah, so there's a theoretical risk that antibiotics can actually worsen certain complications in those specific cases.
Oh, wow.
However, when it comes to treating shigellosis,
Okay.
the benefits outweigh the risks. So treatment shouldn't be withheld solely because of this concern.
Okay.
Yeah.
So it's about weighing the potential benefits
Yeah.
versus the risks
Exactly.
for each patient.
And that's where, expertise of a microbiologist comes in.
Right.
And the AWARE book actually provides a great guide.
Okay.
It's table 14.6.
Yeah.
It outlines the first and second choice antibiotic options for both adults and children.
So let's dive into that table a little bit. What does it recommend as a first-line treatment for adults with significant bloody diarrhea?
So the book recommends ciprofloxacin.
Okay.
That's a fluoroquinolone antibiotic.
Right.
And the dosage is 500 milligrams every 12 hours, and you give that for a total of 3 days.
Okay. In children, is it the same?
Not quite. For children, the dosage is weight-based, so it's 15 milligrams per kilogram of body weight every 12 hours. And the book even provides these weight bands. So, for example, a child weighing like 3 to 6 kilograms would get 50 milligrams of ciprofloxacin every 12 hours.
Okay. So adjust those dosages.
Yes, exactly.
Okay. So what if there's a high suspicion of ciprofloxacin resistance? What are the alternative options then?
In that case, the book recommends azithromycin as a second-line treatment.
Okay.
And for adults, it would be 500 milligrams once a day on day 1, and then 250 milligrams once a day for the next 3 days. So that's a total of 4 days.
Okay. And for children?
For children, it's 10 milligrams per kilogram of body weight,
Okay.
given once a day for a total of 4 days.
Okay. So we've got ciprofloxacin, azithromycin, any other antibiotic options listed in the book?
Yeah, it also lists sulfixamide, sulfamethoxazole, trimethoprim, and ceftriaxone as potential alternatives.
Okay. And each of those has their own specific dosage and duration,
Right.
which we can all find in table 14.6.
Exactly.
Now, there's a separate section in the AWARE book on antibiotic treatment for cholera.
Yeah.
What are the key points there?
So it emphasizes that antibiotics aren't used for all cholera cases,
Okay.
only in specific situations, like for hospitalized patients with severe dehydration or those with other risk factors.
Okay. So what are those recommended antibiotic options then?
So the book recommends azithromycin as first-line treatment
Sure.
for both adults and children.
Okay.
For adults, it's a single dose of 1 gram.
Okay.
And for children, it's 20 milligrams per kilogram of body weight,
Right.
also given as a single dose.
Okay. Are there alternative options if that's not appropriate?
Yeah. Doxycycline and ciprofloxacin are listed as second-choice options for adults.
Okay.
However, the book does note that azithromycin is currently preferred because there's decreasing susceptibility to tetracyclines and fluoroquinolones.
So again, really important to stay on top of those resistance patterns.
Exactly.
Okay. Let's switch gears now and talk about how these infections actually take hold in the body. So the pathophysiology.
Okay. So it usually starts with ingestion of contaminated food or water.
Right.
And then from there, the pathogen has to survive that acidic environment of the stomach.
It's like a gauntlet.
Exactly. Some have developed ways to withstand that acid, and they make their way to the intestines.
Okay. And once they're in the intestines, what happens?
Well, the mechanisms are different depending on the pathogen,
Okay.
but generally they invade the lining of the intestines, they disrupt fluid and nutrient absorption,
Okay.
and they trigger an inflammatory response.
Which is what leads to the symptoms, I imagine.
Exactly. And then we have those enterotoxins we talked about.
Yeah, right.
Those are proteins produced by certain bacteria.
Right.
And they essentially disrupt the normal function of the gut, leading to more fluid loss and worsening that diarrhea.
Okay, so let's talk about the epidemiology, the big picture.
Okay.
We know it's a global issue.
Yeah.
So what are those risk factors driving this?
So the AWARE book really highlights these 3 key factors.
Okay.
Acute malnutrition, limited access to safe drinking water,
Right.
and inadequate sanitation.
Yeah. It's kind of like, all these social economic factors all play a role, right? Poverty, lack of access to clean water, poor sanitation.
Exactly.
That creates this environment where these infections can really thrive.
Yes. Addressing those underlying issues is super important for making a real impact.
Yeah. And vaccination, that's key too, right?
Yes. Vaccination is super important. The book specifically talks about vaccines for rotavirus and cholera.
Yeah.
And those play a major role in preventing these diseases, especially the rotavirus vaccine.
Right.
It significantly reduced the incidence and severity of diarrhea in children.
Now, I know we talked about the measles vaccine too.
Right. Even though it's not directly targeting diarrhea,
Right.
it can still have an indirect benefit
Right.
because it's preventing measles, which can lead to diarrhea. So again, it's a multifaceted approach.
Absolutely. So before we move on to the WHO's specific recommendations, I think it's worth reiterating that antibiotics are not needed for most cases of acute diarrhea.
Exactly. Rehydration is always the first and most important step. And antibiotics are reserved for specific situations.
Right, like bloody diarrhea, immunocompromised patients, or suspected cholera. Okay,
Exactly.
let's break down those recommendations.
Yeah.
Table 14.6 in the AWARE book is our guide here.
Yes.
First choice antibiotic for adults with significant bloody diarrhea. What does it recommend?
It recommends ciprofloxacin.
Okay.
And the dosage is 500 milligrams given every 12 hours for 3 days.
Okay. And children? The same.
No. Children, it's weight-based.
Okay.
It's 15 milligrams per kilogram of body weight
Correct.
every 12 hours. The book also gives you these handy weight bands. So if a child is like between 3 and 6 kilogram,
Right.
they would get 50 milligrams of ciprofloxacin every 12 hours.
Adjust those dosages.
Yep.
Okay. Now, what if there's a high suspicion of resistance to ciprofloxacin? What are our options then?
Then the book recommends azithromycin.
Okay.
The dosage for adults is 500 milligrams once a day on day 1, and then 250 milligrams once a day for the next 3 days.
Okay. And what about for children?
For children, it's 10 milligrams per kilogram of body weight, given once a day
Right.
for 4 days.
So we've got ciprofloxacin, we've got azithromycin. Are there any other antibiotic options that it lists?
Yeah. It also mentions cefixime, sulfamethoxazole, trimethoprim, and ceftriaxone as potential alternatives.
And each of those, of course, has its own dosage
Right.
and treatment duration,
Exactly.
which can be found in Table 14.6.
Oh,
Now, I know that there's also a separate section in the AWARE book
yes.
on antibiotic treatment for cholera.
Right.
So what are the key takeaways from that section?
The main point is that antibiotics aren't routinely used for all cholera cases,
Right.
only in certain situations, like for hospitalized patients with severe dehydration
Okay.
or patients with other risk factors.
Okay, so it's a more targeted approach, much like what we've been talking about.
Exactly.
Okay. So what are the preferred antibiotic options for cholera then?
The book recommends azithromycin as the first-line treatment for both adults and children. The adult dosage is a single 1-gram dose.
Okay.
And for children, it's 20 milligrams per kilogram,
Okay.
also given as a single dose.
Okay. What are the alternatives if that's not suitable?
Doxycycline and ciprofloxacin are listed as second-choice options for adults.
Okay.
But the book does say that azithromycin is currently preferred because of the decreasing susceptibility to tetracyclines and fluoroquinolones.
So again, staying up on top of those resistance patterns.
Yes, absolutely.
Really important. Okay.
Yes.
I know we've covered a lot of information already in this deep dive,
We have.
but we've only just scratched the surface.
We have.
There's always more to learn, and we encourage our listeners to keep exploring, the latest research and guidelines.
Absolutely. Ongoing learning is essential.
Right.
But let's recap
Yeah, let's recap.
what we talked about.
What are the main takeaways?
Okay, so we talked about acute infectious diarrhea.
Yeah.
It's a global health problem, especially in young children. We learned that most cases are caused by viruses and resolve on their own.
Right.
Rehydration is super crucial. It's the cornerstone of treatment. Doesn't matter the cause.
And we spent a lot of time talking about antibiotics,
Yes.
emphasizing that they are not routinely recommended
No, they're not.
and should be reserved for specific situations. We
Absolutely.
talked about bloody diarrhea,
Yeah.
immunocompromised, suspected cholera.
Yes. And even when they are indicated.
Right.
It's super important to choose the right antibiotic. You got to look at the local resistance patterns,
Right.
the patient's age, their weight, other individual factors.
We also talked about the importance of preventive measures.
Yes.
Access to clean water and sanitation.
Yes.
Good hygiene practices.
Yes.
Vaccination.
Yep. Excellent points.
Yeah.
And, good clinical judgment and staying up to date on research is essential.
Now, before we wrap up this part of our deep dive, I want to leave you with a thought. As a medical microbiologist, you're at the forefront of diagnosing and managing these infectious diseases. But your role extends beyond the individual patient.
Right. Yeah.
You have this unique opportunity to advocate for these preventive measures.
Yeah.
The access to clean water, sanitation, the vaccination coverage.
Absolutely.
I mean, these are the keys to really making a difference.
Yes, we can be powerful voices for public health.
Yeah.
Both locally and globally.
It's inspiring. All right, well, let's take a short break. We'll be back with the final part of our deep dives, where we'll explore some real-world scenarios and test your knowledge.
Sounds good.
With some challenging questions.
Welcome back to our deep dive on acute infectious diarrhea using the WHO's AWARE book as our guide.
We've already talked about the definition, the clinical presentation, and how antibiotics aren't usually the answer.
Right, focusing on rehydration and reserving those antibiotics for specific situations.
Exactly. So before the break, we were just starting to talk about those microbes that cause all this trouble.
Right.
And the AWARE book actually has some really helpful tables.
It does.
That break down those most likely pathogens.
Yes.
So table 14.1 focuses on children.
Okay.
And it lists kind of the usual suspects there: rotavirus, norovirus, adenovirus. But it also points out that measles, which we think of as a respiratory thing, can actually cause diarrhea as a complication.
Yeah.
It's like a multitasker of the microbe world.
Yeah.
But it's not just viruses we need to consider in kids.
No, not at all. Bacteria like E. coli, Shigella, Salmonella can also be problems, especially when there's limited access to clean water and sanitation.
Makes sense.
And we can't forget about parasites like Cryptosporidium.
Right. So it's a pretty diverse lineup of potential offenders.
Yeah.
Now, table 14.2 shifts the focus to adults.
Okay.
What are the key takeaways there?
Well, the pattern's similar to what we see with children, with viruses being common, like norovirus. But what's interesting is that bacterial causes actually seem to be more prominent in adults, especially in those high-income settings.
Okay.
Campylobacter, Salmonella, Shigella.
I wonder if that's lifestyle.
It could be.
Maybe diet or the environments we're exposed to as adults.
Yeah, it's a good question.
Yeah, something to think about. Now, table 14.3 kind of guides us towards parasites for those cases of diarrhea that just won't quit.
Right, those persistent or chronic cases.
Right. And those parasites, man, they're good at making themselves at home in the gut.
They are.
So it mentions Cryptosporidium, Microsporidium, Cystoisospora belli.
Yep.
I thought this was interesting. The book specifically points out that patients with persistent diarrhea, especially those living with HIV, often receive unnecessary antibiotic treatment.
Yeah, it's a good point that antibiotics aren't the solution to everything.
No, they're not.
And sometimes they can actually cause more harm than good.
Absolutely. Okay, so we've got a good grasp, I think, on the potential culprits.
I think so.
Let's shift gears now and talk about what happens when those pathogens actually gain a foothold in the body.
Okay.
So pathophysiology.
Right. So it all starts with that ingestion of contaminated food or water.
Right.
Once the pathogen is inside, it has to overcome that first line of defense, which is that acidic environment of the stomach.
Right. That stomach acid is like nature's disinfectant.
Exactly.
But I imagine some of these microbes are pretty hardy, so.
They are. Some pathogens have actually developed ways to survive that stomach acid.
Wow.
And then reach the intestines where they can really start causing problems.
Right. So once they're in the intestines, what happens next?
So the specific mechanisms vary depending on the pathogen.
Okay.
But generally, they invade the lining of the intestines. They disrupt that absorption of fluids and nutrients.
Right.
And they trigger an inflammatory response.
And that's what leads to all those symptoms.
Exactly.
That we associate with diarrhea.
Yep. And don't forget about those enterotoxins.
Oh, right.
Some bacteria, they produce these proteins that actually further disrupt the function of the gut. So more fluid loss, and that makes the diarrhea worse.
Wow, it's amazing how such tiny organisms can have such a big impact on our body.
It is.
Okay, let's zoom out again. Back to the big picture.
Okay.
Epidemiology of acute diarrhea. And you talk about the global burden. I'd like to hear more about those specific risk factors.
Okay, so the AWARE book really emphasizes these three. Acute malnutrition, limited access to safe drinking water, and inadequate sanitation.
Yeah, so again, it's not just a medical problem. It's tied to these social and economic factors.
Absolutely.
Poverty, lack of access to clean water, poor sanitation. I mean, that's just that perfect storm for these infections to really thrive.
It is, and addressing those underlying issues is critical for making a dent in the global burden of this disease.
Absolutely. And then vaccination, that's a critical piece of that puzzle, right?
It is, and the book talks about vaccines for rotavirus and cholera, and those play a major role in prevention.
Especially the rotavirus vaccine.
Yes, it's significantly reduced the number of cases we're seeing.
And we talked about how even the measles vaccine, even though it doesn't directly target diarrhea, can help indirectly by preventing measles and its complications.
Absolutely.
So it's a multifaceted approach to prevention.
It is.
Right. Now, before we go into the WHO's recommendations for antibiotic treatment, I think it's worth saying again that most cases don't actually need antibiotics.
No, they don't. Rehydration is always that first line of defense.
Yes.
And we really want to reserve antibiotics for specific situations.
Like bloody diarrhea, severely immunocompromised patients, or if we suspect cholera.
Exactly.
Right.
So let's look at those situations where antibiotics are warranted. The AWARE book, Table 14.6, gives us a really helpful framework for choosing the right one.
Okay. So starting with adults with bloody diarrhea, what's the first choice antibiotic?
The book recommends ciprofloxacin, and that's given at a dosage of 500 milligrams every 12 hours for a total of 3 days.
Okay. And children, same dosage.
For children, it's weight-based. So it's 15 milligrams per kilogram of body weight every 12 hours.
Okay.
And the book has these helpful weight bands. So if the child is between 3 and 6 kilograms, they would get 50 milligrams of ciprofloxacin every 12 hours.
So adjusting the dosage based on the weight of the child.
Very important.
Okay. What if there's a high suspicion of resistance to ciprofloxacin? What are our options then?
Then the book recommends azithromycin.
Okay.
And that's given at a dosage of 500 milligrams once a day on day 1, and then 250 milligrams once a day for the next 3 days.
Okay.
So that's a total of 4 days.
And children?
For children, it's 10 milligrams per kilogram of body weight given once a day for 4 days total.
Okay, so ciprofloxacin, azithromycin, any other options listed?
It also mentions cefixime, sulfamethoxazole, trimethoprim, and ceftriaxone as potential alternatives.
Okay, and each of those has its own dosage and duration, which can all be found in Table 14.6. Always a good idea to refer back to the source. Now, there's also a separate section on cholera.
Yes.
And antibiotic treatment.
Right.
So what are the key takeaways from that?
Well, the main point is that antibiotics aren't routinely used for all cholera cases, only in specific situations.
Okay.
Like a hospitalized patient with severe dehydration.
Right.
Or a patient with some other risk factors.
Okay. So a more targeted approach.
Exactly.
Okay. What are the preferred options for cholera, according to the WHO?
The book recommends azithromycin as that first-line treatment for both adults and children. And the adult dosage is a single 1-gram dose.
Okay.
And then for children, it's 20 milligrams per kilogram, also given as a single dose.
Okay. Alternatives, if that's not suitable.
Doxycycline and ciprofloxacin are listed as second-choice options for adults, but azithromycin is preferred at the moment because of the decreasing susceptibility to those other drugs.
Again, highlighting the importance of staying up to date on those resistance patterns. Seems like a recurring theme here.
It is.
Okay, I want to switch gears a bit. I'm curious to hear your thoughts on the role of the gut microbiome in acute infectious diarrhea.
Yeah, that's a good question. You know, the gut microbiome, that community of microorganisms that live in our intestines, play a really critical role in our digestive health.
Right, so when that balance gets disrupted, things can go off the rails.
Exactly. And when a pathogen gets in there, it can disrupt that balance. And that leads to, an overgrowth of the bad bacteria and a decrease in the good bacteria.
Right.
And that can make things worse.
So how does that actually impact the diarrhea itself?
Well, that disruption can exacerbate the symptoms, so longer illness, increased risk of complications. It's like a domino effect.
So the pathogen, the microbiome, the host's immune response, I mean, it's all interconnected.
It is, and understanding those interactions is crucial for figuring out treatments and preventions.
Speaking of prevention, we've talked about access to clean water and sanitation, vaccination. What about probiotics?
Oh, yeah.
Do they play a role?
That's an area of ongoing research.
Yeah.
And there's some promising evidence that suggests that they might be beneficial.
Okay.
Probiotics are live microorganisms that when consumed in adequate amounts can be good for you. And they can help restore that balance in the gut microbiome.
Right, that we talked about.
So it's like reinforcing that microbial army that's in your gut.
Exactly. And some studies have actually shown that certain probiotic strains can shorten the duration and the severity of diarrhea, especially in children.
Interesting.
Yeah. But, more research is needed to really figure out the role of probiotics in managing this.
Right. It's an evolving field.
It is.
But there's definitely potential there.
Absolutely.
Now, before we wrap up this part, I want to circle back to something you mentioned earlier about the role of the medical microbiologist in addressing this global health challenge.
Right.
Yeah, absolutely. Our roles go beyond just the lab and the clinic.
Right.
As medical microbiologists, we have this deep understanding of the pathogens, how they're transmitted, the factors that contribute to their spread.
Right.
And we're in a unique position to advocate for change.
So using our expertise to push for better sanitation, access to clean water, increased vaccination coverage, I mean, those are the things that really make a difference.
Absolutely. We can be powerful voices for public health in our communities and on a global scale.
It's pretty inspiring.
Yeah.
All right. Well, we've covered a lot of ground in this deep dive.
We have.
But we still have one more segment to go.
We do.
We'll be back with the final part of our deep dive, where we'll test your knowledge with some exam questions and explore some real-world scenarios that'll really highlight the complexity of this. And we're back for the final part of our deep dive into acute infectious diarrhea. We've covered a lot of ground.
We have.
From the microscopic world of pathogens to the, all-important rehydration and, the targeted use of antibiotics.
Absolutely.
But, as we all know, those textbook guidelines don't always reflect what happens in real life.
Right.
So to really test our knowledge, I thought we could walk through a few case studies.
Okay, I like that.
Time to apply what we've learned.
Yeah, let's do it.
So imagine you're in the clinic and a 3-year-old child is brought in with a 3-day history of watery diarrhea, vomiting, and fever.
Okay.
The child is lethargic, has sunken eyes.
Okay.
Parents are saying that they're having trouble keeping down fluids.
So right away, we're thinking dehydration, which is always a big concern with little kids.
Especially when they can't keep anything down.
Absolutely. That makes it even more urgent.
So what would be your initial approach?
Okay, so given the age and those signs of dehydration, I would probably start with IV fluids.
Okay.
To get those electrolytes and fluids back up quickly.
That makes sense. Would you order any lab tests while that rehydration is happening?
I probably would. I mean, considering the age and the fever, maybe a stool culture to rule out a bacterial cause.
Okay.
While most cases in this age group are viral, it's best to be on the safe side when there are those signs of a more systemic illness.
Okay, so addressing the dehydration aggressively.
Yes.
And we're looking for that potential bacterial culprit.
Exactly.
So let's say that stool culture comes back positive for salmonella.
Okay.
How does that change your management?
That's a good question. So, not all salmonella diarrhea needs antibiotics.
Okay.
So if the child's responding well to the rehydration and they're getting better, we might just hold off on the antibiotics and just watch them really closely.
Okay, but if they don't improve or if things get worse, then we'd go for the antibiotic.
Exactly. And we'd look to those WHO guidelines and choose the best antibiotic based on, local resistance patterns.
That case really highlights how important those early assessments and interventions can be. Okay, ready for another case study?
Hit me.
Okay, so picture this. A 25-year-old traveler comes in with a 2-day history of bloody diarrhea and abdominal cramps.
Okay.
After returning from Southeast Asia.
Travel-associated diarrhea.
Yeah.
Always a fun one.
What are your initial thoughts?
Well, that bloody diarrhea is a concern. Makes me think bacterial infection.
Okay.
And then with the travel history, we have to think about pathogens that might be more common over there.
Right. What kind of things come to mind?
Well, bacteria like Shigella, Campylobacter, certain E. coli strains.
Yeah.
They're known to cause bloody diarrhea, and they're more common in certain parts of the world.
Okay. Given the severity of the symptoms, would you consider starting empiric antibiotic treatment while waiting for the lab results?
I probably would, especially with that bloody diarrhea. I mean, it just suggests a higher chance of a bacterial cause.
Right.
But of course, I'd get a stool culture going too.
Okay.
To confirm and make sure we're on the right track with treatment.
Right. So weighing the risks and the benefits.
Exactly.
carefully.
Well-
Okay. Let's say the stool culture comes back positive for Campylobacter.
Okay.
What then?
So Campylobacter infections, they often get better on their own.
Okay.
But in this case, given how bad the symptoms are and that blood in the stool,
Right.
I'd probably continue those antibiotics
Okay.
to help them recover faster and to lower the risk of complications.
So it's about individualizing the treatment plan.
Absolutely. And, we always want to emphasize supportive care,
Right.
like rehydration, rest. Those things are key for recovery.
Ready for one last case?
Bring it on.
All right. This time, it's a 6-year-old woman who develops watery diarrhea and abdominal cramps. A few days after being discharged from the hospital,
Okay.
she was treated for pneumonia with a broad-spectrum antibiotic.
Ooh, sounds like maybe C. diff.
Yeah.
That antibiotic use is a big risk factor for that.
What steps would you take to confirm and manage this?
Okay, well, first, I would definitely order a stool test, specifically for C. diff. And while we're waiting for those results, we got to isolate the patient,
Right.
to prevent spread, because that infection is very contagious.
Absolutely, yeah. Those infection control measures are key.
They are. So let's say the test comes back positive for C. diff.
Okay. Antibiotics would definitely be the main treatment in this case.
Okay.
The choice would depend on the severity and her overall health. But
Right. And C. diff can be tough to treat.
yeah,
Sometimes it comes back even after treatment.
it does. Close monitoring and follow-up are going to be super important
Absolutely.
to make sure it's gone and to prevent those recurrences.
Agreed.
Those case studies were great.
Yeah.
I mean, they really show how we can take those textbook guidelines and apply them to those messy real-world situations.
Absolutely. It's all about critical thinking, looking at the individual patient,
Right.
being ready to adapt.
Yeah. Okay, before we wrap up, I thought it'd be fun to do a little pop quiz
Oh, I love a popcorn.
to test our listeners' knowledge. All right, first question. True or false, antibiotics are the first-line treatment for most cases of acute infectious diarrhea?
False. Most cases are viral. They go away on their own, so rehydration is what we need.
You got it. Okay. Question number 2. Which of these is the most important initial treatment for acute diarrhea? And this is regardless of the cause. Is it A, antidiarrheal medication, B, rehydration therapy, C, antibiotic therapy, or D, probiotic supplements?
It's B, rehydration therapy. Always got to start there.
Absolutely. All right, question 3. Which of these clinical presentations of diarrhea is most likely to need antibiotics? A, water diarrhea with a mild fever, B, bloody diarrhea with abdominal crampings, C, persistent diarrhea lasting 10 days, or D, diarrhea associated with recent travel?
I'm going to go with B, bloody diarrhea with abdominal cramping. That blood suggests a bacterial infection.
Yeah, that blood is a red flag. 2 more to go. Question 4. What's a key microbiological consideration when we're choosing empiric antibiotic treatment for this? Is it A, the presence of fecal leukocytes, B, the patient's blood type, C, local resistance patterns of common bacterial pathogens, or D, the patient's travel history?
It's C for sure. Local resistance patterns.
Got to stay on top of those.
Absolutely. Got to use antibiotics that are actually effective against the bugs that are circulating.
Yeah. Last question. True or false, routine stool testing is recommended for all cases of acute infectious diarrhea to figure out the cause?
False. We don't always need to do that, especially when most cases are viral and they get better on their own.
Yeah, all right. You aced it.
Woohoo!
5 for 5.
Oh.
Sounds like our listeners have been paying attention.
I think so. It's a good reminder that even with something common like diarrhea, there's always more to learn.
I want to thank everybody for joining us for this deep dive. We hope you've learned some valuable things to take back to your practice.
And, stay curious, keep learning, and always advocate for the health of your patients and your communities.
Well said. Until next time, stay informed and keep those microbes at bay.